Hey everybody, it's Dr. David, the ENT doctor again. These kids are amazing. Another great question, and the question was very straightforward. They wanted to know why the dentist had decided to send them to see me, because they had gone in to get their teeth checked, and both the child and the parent, which is probably where the question really came from, were a little bit perplexed as to why the dentist had decided that getting an ear, nose and throat doctor to check out things was worthwhile. So the way I explained it is that the body is a very complicated thing, and there's lots of parts of the body, and different people know different things about the body. And I certainly know from a medical point of view that we get next to no training in dentistry. So you talk about this part of the body, and it's really lost to the medical side of things in terms of healthcare. There are a range of things that dentists are very well trained in. And by the way, when I say dentists, I'm not just meaning the dentists themselves. I'm talking about the dental team. So I'm talking about the therapists and the hygienists as well. Collectively, they're all an amazing group. And they're very skilled and very well trained in finding problems. Now, some problems are very easy, and some problems are very subtle in terms of giving you clues. So when I answer the question, I say, look, the body is very complicated, and the people that look at your teeth and look inside your mouth, that's all they look at in terms of the things they need to know about. And when they do that, they get to know a lot of things about what's inside your mouth. So when they have a look, they'll have a look at your teeth. They want to know if your teeth are straight or crooked. They want to know if your teeth have got holes in them. They also want to look at your jaw. Are your jaws growing properly, because the teeth attach to the jaws? And they want to look at your gums. They want to see if your gums are healthy, because you need to have healthy gums to keep those teeth healthy as well. And since they're inside the mouth, they'll have a look around inside your mouth too. So they might have a look underneath your tongue. They might have a look at the back of your throat. So the dental people are spending day in, day out looking in mouth after mouth after mouth after mouth. They look in the mouths every day, and the only sort of medical people that do the same would be ear, nose and throat doctors, in terms of every single person that comes in through the door gets a look inside the mouth. And maybe anaesthetists, putting people to sleep, but even then they don't necessarily need to look inside the mouth all the time. So by far, from a healthcare point of view, in terms of tomorrow, when people have their mouths looked at, the majority of them, it's going to be done by dentists. There's more dentists than ear, nose and throat doctors. So full stop, mouth examinations, dentists and hygienists and therapists collectively for the win. So what are the sort of things that they're on the lookout for that could relate to them needing to see an ear, nose and throat doctor? Well, for example, they might find that the teeth are crooked. They might find that the jaws are not growing properly. They might find that there's holes in the teeth, and these holes are far more than they should be, because the child and everyone involved is getting the teeth clean and they're eating well, but they just keep getting these holes in the teeth. They may find changes of the teeth getting worn away by stomach acid coming up into the throat, into the back of the mouth, and affecting particularly the teeth at the back. So having a really good look at the back of those teeth is really important. They might notice very subtle or very obvious changes relating to teeth grinding, wearing those teeth down. They may see that the gums are unhealthy. They may see that the tonsils at the back of the throat are big. They may see that underneath the tongue's not able to lift up properly and not moving around properly. So the dental professionals can pick up a host of things from an oral examination. And it's not just a matter of having a look inside and going, oh, yep, there we go. They obviously pay very, very particular detail to things. And that's why it's very, very common that the dental professionals will find problems inside the mouth and then recognize how it relates. So, for example, the most common cause of teeth grinding in children is not being able to breathe properly. That's an ear, nose and throat problem. Mouth breathing is an ear, nose and throat problem. Mouth breathing, apart from causing teeth grinding, can also cause problems such as poor gum health, crooked jaws, crooked teeth, It can also relate to getting holes in the teeth, because with the mouth open, the mouth dries out. That opens up for the bacteria inside the mouth to grow and flourish, and the bad bacteria create the holes. And having breathing problems is also related to reflux. And also, if they spot big tonsils, well, that's an obvious. And then what about the tongue tie? Well, tongue ties can cause teeth grinding. Tongue ties have a relationship with the way the jaw and the teeth develops. And it's not just the dental team, it might be that it's the speech therapy team that is picking up on a child that's not speaking properly. And then they realize that, okay, they're not speaking properly because, for example, they can't breathe properly. Their nose is blocked, so that changes their voice. They may have big tonsils at the back of their throat, so that changes how things work and move around. They may have problems with their jaw development, that can have an influence. And also the tongue not being able to move properly can have an influence. And then mixed in with all these things, again, being ear, nose and throat, there's a high rate of having ear problems. So these children may have a history of ear infections or middle ear fluid. And what again, a lot of is things that are not taught in the medical side of things is how having middle ear problems can relate to having jaw problems. It can relate to having breathing problems. So there's a huge range of people that we've got out there that have a huge amount of skill, experience and knowledge that we really need to take on board and reward them for their knowledge and respect them for their knowledge. So it's not unusual. For example, the dentist will pick up a couple of things and say, you need to see an ear, nose and throat doctor. And someone might sort of just want to double check things. And because we're not trained in the healthcare system as medical doctors on dentistry things, we may not fully understand why the dentist was worried in the first place. And we might have a misunderstanding that is completely avoidable by working together. So apart from putting this video together to help explain why I think working with dentistry as an ear, nose and throat is important, I think we need to go beyond that. I think we need to also help my other medical colleagues, regardless of what sort of medicine they practice, to have a greater awareness of what dentistry has to offer with respect to being the guardians of the airway. And given that, as I said, come tomorrow, more mouths will be looked in by dentists than any other health professional. They need to have that assessment respected, and their advice needs to be taken on board, because if we dismiss what the dentist is worried about, then we're doing a disservice to the patient. And it's interesting when you look at the scientific literature that's out there, because you go back to the late 1800s, there are journal articles in ear, nose and throat journals written by dentists saying, ENTs, we need your help. Please take us seriously, because this is the problem that we have found, and we would appreciate if you could take us seriously and be proactive with respect to sorting things out. So I think that's worth bearing in mind. Have a good day.